Hi everybody, Dr. Gayner, Facial Plastic Surgery. I often get asked what is my favorite procedure, and it doesn't take me long to answer rhinoplasty or nose reshaping. Why is that? I like it because it's technically difficult, but also for the most part I'm giving those patients who undergo this procedure a nose they've never had. Unlike when I do neck lift surgery, yeah, that patient used to have a neck up here and I'm restoring that, and that's great. But giving a patient something they've never had or never envisioned is really, it's quite powerful to me and the patient. We can do them at virtually any age. How young can we go? Women, 15, men, 16. So think about that. I take a 15-year-old young lady who has a big bump on her nose and is getting kidded, about to go to college in a few years, etc. And with a procedure that takes less than an hour and very little downtime or social downtime, we can give them a nose that nobody's ever going to pay attention to again in a negative way for the rest of their life. So that's really, again, quite powerful. Eyelid surgery, neck lift surgery, sometimes we repeat those many years later, but rhinoplasty is one of the few things that I can do at any age, but at a young age, and you'll never need to do it again. We have a surgery center just across the hall, so it's done there. It's done under general anesthesia, so the patient won't feel anything. Again, this generally takes me less than 60 minutes. Surprisingly, patients don't need prescription pain medication. They take Tylenol, if that. Most of the time they say the thing that bothered me the most was just being a little stuffy like a cold. I don't put any splints or packing into the nose. When you Google rhinoplasty and surgery, you might hear about that. None of that. Just a little splint on the outside, you get a little black and blue. So that's kind of my rationale and my passion for why I love to do rhinoplasty. And next week we'll do a video a little bit more on what are we attempting to change, a little more anatomy, a little more technical stuff. But that's my favorite procedure.